This short video will cover high-yield topics related to dentistry for the pediatrics board exam. Primary eruption typically occurs between 3 to 16 months. Usually it's around 6 months when babies start with solid foods. The order of eruption is the lower central, then upper central, then lateral incisors, then the first molars, then the canines, and then finally the second molars. The most common reason for a delay in primary eruption is familial delayed eruption. Some associations and syndromes related to delayed dentition would be hypothyroidism, hypopituitarism, rickets, ectodermal dysplasia. With ectodermal dysplasia, you may also see the buzzwords of alopecia and then sweating defects. When asking parents to brush their children's teeth, we start with a smear of fluoride toothpaste if they're less than 3, and then instruct for a pea-sized amount for patients who are 3 to 6-year-old. We can start flossing once the teeth are touching, and the patient should see a dentist 6 months after the first tooth eruption or at 12 months of age, whichever one comes first. Patients should have established with a dental home by their first birthday. Cavities or caries are most commonly caused by strep mutans in the pits and fissures of the teeth, and usually children are introduced this from their caregivers' mouths. Caries are most common in the upper incisors and then the primary molars. The order that you'll see is for cavity development is the plaques first, then white spots, then enamel caries, then dentine caries, and then pulpitis if the cavity has progressed through the enamel, through the dentine, and then to the pulp itself. Finally, the emergency of dental avulsion, where the tooth is displaced from the socket. This would not be an emergency if it's a baby tooth. You don't need to do anything for this. But if it's a permanent tooth, you want to try and replace the tooth into the socket within 30 minutes. If that's not possible, then you would transport it in milk or saliva, and you would clean it if it fell into the dirt or something like that by holding the crown and rinsing it gently, but you shouldn't touch the root or brush the root.